Okay, good afternoon, everyone. I'm Dr. Madhu, and on behalf of Department of Physiotherapy, University of Engineering and Management, Jaipur, would like to welcome you all on the day 4 of our Expert Talk series in association with Jaipur Physiotherapy Network. I hope you would enjoy this eminent session and learn something new today. So, without further ado, I would like to introduce our speaker for today's session, Dr. Samiksha Gupta. Ma'am is a PhD scholar and is currently working as Associate Professor and Vice Principal of Jaipur Hospital College of Physiotherapy. She is a pelvic floor rehabilitation specialist. She is also an owner of SG Pelvic Floor Clinic, the first pelvic floor clinic in Rajasthan. Ma'am, we welcome you for this session. Over to you, ma'am.
Thank you, doctor. Welcome all. As you can see my screen right now, this is International Institute of Pelvic Floor Research, Rehabilitation and Education, that is WOW-IP. This webinar is all about the introduction of women health, fertility, reproductive, transvaginal and transrectal rehab, which I am practicing daily. Going further, let me first start my session with a special thanks to Dr. Desai sir, who is also the founder of WOW-IP and also known as the father of modern pelvic floor rehabilitation. What will be our agenda going on now? We will have an insight of puberty and adolescent physiotherapy, fertility health and physiotherapy, sexual health and physiotherapy. All these topics are the further divisions of super specialized branch that is women health now in physiotherapy. Earlier, few years back, we used to talk about when we talked about women health, it was only obstetric health and physiotherapy, that is antenatal, postnatal exercises. But what is the basic, beauty of physiotherapy is that we are just stopping the medications of the patient, or we are just minimizing the medications, and we are giving the patient's treatment in the patient's own hand by the fact of exercises, some modalities, and some regular practicing things at home also when we just free the patient or discharge the patient after a treatment. So these all things are carried over in the various aspects of physiotherapy in women health. When we see, it is not only about the obstetric health, from starting from childhood till the adult or geriatric care, in every field of women health, physiotherapy is required. And I should like to I would like to consider a case at this point of time that when I have been practicing since many years, I have seen small children also who are having stress incontinence, care by bedwetting, ecophoresis, all these things. So, what is happening over here? In each and every age group, physiotherapy is required because by the medications we cannot treat most of the things. So, going in that divisions, we have puberty in adolescence and physiotherapy, fertility, health and physiotherapy. Nowadays, IVF centers has been developed. And what is the basic thing behind that? There are additions inside because of which the fallopian tube mobility has been compromised. So we are reversing all those things by our treatments. There is sexual health and physiotherapy. I will discuss a story later on in my own presentation about it. Obstetric, all we know very well. Pelvic floor dysfunction and physiotherapy is my specific domain which I am working in, and I know that the patients who are coming to you are actually the sufferers. They are just like with you and saying, "Ma'am, कैसे भी ठीक कर दो बस." Because you know what is the irony with the patient? One who has having back pain is still okay, can survive. But for a person who is getting urine leakage at a workplace is a big deal of problem with her. So, this is a basic domain which come across with other conditions also we'll discuss later. Next is pelvic floor rehab and breastfeeding. During breastfeeding, it is also a different type of field because breastfeeding, the primies never understand about it, what is basically how to do it. A newborn child is definitely not trained about it. So there are a lot of things, there are hurdles in which we do pelvic floor rehab as well as the breastfeeding training and all those things in this field. Next is pelvic floor rehab and back pain. It is a very important topic for not me, for each and every physio around us. We talk about core. We talk about core, and pelvic floor muscle is a very important component of core. So we are just forgetting it. It is the most forgetful muscle in our body, pelvic floor. So if we are, I'll tell you in my presentation and in between or maybe later on, I will tell you each and every physio can recruit the pelvic floor even without exposing the patient's perineal area and without male to male or female to female. There's a very simple technique in which everyone can follow this, and we can recruit pelvic floor of each and every patient. And what will be the effect of it? Long-term rehabilitation of a low back pain patient will be definitely giving a best results in that, which I'm seeing in my practice. Not even a single patient is going of back pain without pelvic floor activation. So let me introduce some more about the father of modern pelvic floor rehab and education. Dr. Heath Desai sir is MPT from USA. He is an entrepreneur,
Ma'am,
innovator. Yeah,
sorry to
yes,
disturb you, ma'am,
yes.
but your voice is a little bit low. So if you can move your mic towards yourself, so we would be able to hear
Okay.
you clearly.
Is it okay now?
Yes, ma'am. Much better.
Okay. Okay. So let me introduce you more with Dr. Heath Desai sir. He's MPT from USA. He's an entrepreneur, innovator, author, and his life mission is to step outside the box to improve the lives. The book Hate's Manual of Pelvic Floor Rehabilitation is one of the Amazon's bestseller in urology, bestseller in gynecology and obstetrics. People are learning, purchasing it, and learning about with it. A lot of people around us, those who are medical practitioners, are also popularly known as Heitzer is also popularly known as father of modern pelvic floor rehabilitation. In Wow Group, all of us have a common vision is to courageously break the cultural taboo and make pelvic floor rehab accessible to each single woman and men on the globe through the innovative technologies and services. So, Hitzer is chairman and founder of WOW IP, WOW Experience Research and Development, WOW Group of Business, WPO, Easy PFM Exerciser. He has intellectual properties like WOW PF360, which we are using in our clinics, V Spa, V Men, V Vagina Fit, WOW Group Mobile application, which is accessible to the patients to do the pelvic floor exercises. And Hitzer's academic contribution involves its MMT, its functional muscle testing and training scale, its self assessment scale, HPPG guidelines, that is HATES provider protection guidelines, HATES reflective result scale, and female sexual function scale and male sexual function scale. These are the academic contribution and intellectual property of HATES. Let me move further to let's come back to the topic. If I ask you this question, which is reflecting on my screen, then how many of us have done MFR for trapezius? As many as physios as lecturing me, 100% people will say yes. But if I say, how many of you have done MFR for levator ani? Then most of you will say no. Why? Because the muscles are inside. We cannot see it. It is the most forgotten muscle. We have never tried. We have never felt the importance of it. Now on, I should say that now on, people are learning about it, more focusing, but more researchers are required in this field, and a lot of work is also required because people should be aware more about it. Next question from me comes like, how many of us have done biceps muscle testing? Then 100% answer will be yes. But nobody has done, it's very less people around us who have done the muscle testing for the pelvic floor. Why should you know all this? Because it can do miracles. How? When I recruited pelvic floor activation in my own practice at my own clinic when I was undergoing the orthopedic and neuro cases later on, I have also a habit to continue these things and to take a long term follow up of the patient. My long term follow up of the patient was increased. And let me tell you one more case. A patient came to me earlier of a pudendal neuralgia. It was a very painful condition for the patient. Gone through a lot of scans, everything, everywhere. He gone to the urogynecologist. He went to the psychiatrist, and it was a severe pain on setting with the pudendal neuralgia. And the basic problem was that the nerve was getting irritated somewhere under the muscles in the perineum. I mean, in between the pelvic floor muscles. So the thing was not detected. The patient started taking various medications. Later on, it doesn't affected it. Patient took the injectables also for the same, and but patient was not at all relieved. He came to us, and I released the patient. The pain was relieved. In it was the patient didn't have to come very long. Only 5 sittings were there, and then the patient came intermittently, and the pain was relieved like a magic. So this is only a thing which needs a proper diagnosis to cure a particular person suffering from a particular thing from a long time, which is not getting resolved by anything. And the patient was only 22 years person. So this is example what you can do with the pelvic floor rehab. If we talk about the life cycle of a woman, starting from childhood, puberty, adolescent, marital age group, pre-pregnancy, pregnancy, post-pregnancy, premenopausal, menopausal, postmenopausal, and old age. All these life cycle have variety of problems associated with pelvic floor and the women health. So gradually, what is happening? The pelvic floor muscles are the transverse muscle, which are anti-gravity muscles, and it is always loading the pelvic organs. So with age, with wear and tear, with lot of things, it is getting weaker and weaker if patient is not aware about it. Most common problem which see in the society are with the female patients is menstrual irregularities and PCOD, PCOS, which is very common right now in most of the young age girls. We can see this condition: endometriosis, dysmenorrhea, obesity, sedentary lifestyle, and infertility. Infertility, we can say, is become a very big problem because of sedentary lifestyles, because of long-term sitting jobs, because of delayed marriages, and all those. And even after there is, if there is any type of inflammatory bowel disease or any type of any ulcerative colitis sort of things, so it can cause many adhesions inside the gynec area, I mean the female reproductive organs, so that the mobility has been restricted. So it is very much like become very fashion that if people have to be cured with IVF and all those things, nobody is going for the natural cures for these things. Let's first talk about the fertility, health, and physiotherapy. When we are teaching and treating a patient with a fertility issue, it is a holistic approach. Not only we are treating the patient internally, externally, but also internally. And in this condition, when females comes to you with infertility or any fertility issue, then not only you are treating a female, but you are seeing the male counterpart and both as well. Then only the problem can be rectified and the treatment can be done. Various things, various approaches for the fertility treatment is like exercise prescription, which we are going with a lot of yoga asanas, various type of stretches, various type of mobility exercises are very helpful in it, and there are specialized exercise programs for the fertility issues. Lifestyle modifications definitely plays an important role, which needs a stress relieving, and also it includes the dietary modifications. Diet and nutrition is very important. Fertility massage is a one thing which we are giving on a regular basis to the patient with a prescribed dosage in various patients according to their cycle, according to the duration of their menstrual cycle. Next, stress reduction techniques are not only important in fertility, but pelvic floor has a direct relation with the stress reduction. So, stress problems. So, we are doing stress reduction along with the pelvic floor therapy also. Yoga and pranayams we are giving, and medications are also very helpful. There are various techniques of visceral mobilizations which are practiced across the globe, and which we also prefer for the patients. Burns technique, Mercier's techniques, Mayan's massage, visceral manipulation. Along with these, castor packs are being used. Vern's techniques was given by Mr. Vern, and it suggests that the healing happens with adhesions. Whenever there is any type of infection in the bowel, for example, small infective bowel obstruction or any type of inflammatory bowel disease, ulcerative colitis, any type of infection in the bowel which persists for a long time, it makes the adhesions, which I told you earlier. And there are almost more than 200 techniques which causes chronic pain, causes dysmenorrhea, causes pain in ADLs also. So these, and finally it leads to infertility. So that has to be cured accordingly by a physiotherapist. It can also cause migraine. Next technique is Mercier's technique. It is a deep pelvic organ visceral mobilization. It is much deeper, and it also relieves adhesions and increase the blood flow to the reproductive organs. Next is Mayan's massage, and this is a technique in which the organ shifts leading to restriction of the blood flow. It is considered the organ shift to from the natural place of theirs. So we, according using the chai energy and repositioning of uterus, we cure the problem by the Mayan's massage. Then peribiral and visceral manipulation. This is one another technique of physical dysfunction in which joint tissue skeletal restriction and manipulation for children is done. We have castor oil packs, and these castor oil packs are usually used for how to. We are giving hot packs. We are giving superficial heating modalities to the patients. The castor oil packs are the specific pack which are used for visceral before vessel manipulation to break the adhesions in the visceral organs. Especially, we are using it. They have an effect of not only relieving the and softening the soft tissue inside, but also it is doing detoxification as well as cleansing internally. So definitely it increases the fertility. Now, moving on the next slide, obstetric health and physiotherapy in this domain, uh, prenatally and postnatally, during lactation, during work, during the ergonomics, we have two specific instruments and intellectual property of HITSER, which you can see in the box right now. These are two specific instruments. One is VFit and one is VDilate. So, as the name suggests, V-fit is for the strength training and V-dilate is for the hypertonus muscles. If the muscles are too tight, V-dilate is used, and the muscles of pelvic floor are too lax, or we can say weak, then V-fit, that is vagina fit, is used. So, these are the two specific instruments designed by YP and HITSER with a very much research. Now, come to the missing link. What is basically the missing link when we are working in our general OPD setup that I told you is like the pelvic floor recruitment. The basic problem which comes with the pelvic floor recruitment is that how to teach the patient. This is the biggest question because either it is a male or it is a female, patient is not at all very happy with the exposure, and unless you expose it is very difficult to confirm how either the pelvic floor muscles are actually recruited or patient is doing a trick movement with the help of adductors or glutei or any other muscles abdominals. So we have to check it. So I mean, when you want to recruit your pelvic floor along with the core activity for the back pain patient, when you progress with the core activations, at that time, what you can do, let me tell you a simple technique that uh, we have both our hands are like it's like a sling. uh, we have to make our hands like this and the tip of our finger with the gloved hands definitely when we are treating the patient of pelvic floor we have to maintain very much hygiene has to be taken care of. That is the very important for as a universal precaution. So always it should be a gloved hand and we should place both our hands under the glutei of the patient, means we should put our hands like this over the chair and patient can sit over it. So the tip of our fingers will palpate the perineum of the patient. And when we say the patient to squeeze or to hold the gas, our commands will be either hold the gas or either control your pee. Just how will you do when you want to go to when you don't want to go to washroom and you're feeling like menstruation? So the patient will squeeze and you will find it either patient is doing it rightly or not. So when next time the students, when I tell them, they say that now the patient is very heavy, then what we will do? That is not a question actually. It will be done for few seconds, few minutes only. It will not compress and crush your hand actually. So it will be put inside the chair, under the chair, and patient can sit above it. Yeah, which can the first results can come if patient is wearing diaper or jeans or tight clothes which you cannot palpate with it. When we are doing MMT, we are in grade one, we are just checking the flickering of movement. So same thing is here. Am I audible to you? Let me confirm. Hello.
Yes, ma'am, you are audible.
Okay. So this is the basic technique which we can use in each and every OPD setup to recruit the pelvic floor activation and do the pelvic floor activation for any condition. So all the patients, when we start pelvic floor rehabilitation, then there is a question where the patients will come from. So patients will come from the same stream where they are coming from right now. Either they can be taken out from ortho, they can be taken out from neuro, from cardio, sports, women health, from any thing. You can make a patient aware by the feedback forms. You can make some flexes on your clinics. You can talk to the patients about it, because the treatment for physiotherapy is a long-term treatment. So, and no patient should go outside your clinic either after without knowing that pelvic floor therapy is also being done in physiotherapy. Now let's talk about the pelvic floor rehab. What are the pelvic floor muscles? We all know it's not a very big deal, I think, but let me. This is a small thing which I'll just have to explain if students are there. Pelvic floor is a trampoline-like muscle which holds the three important visceral organs above it. Anteriorly, starting from pubic symphysis, it is urinary bladder. Later on, there is uterus. Next, there is rectum and anal canal. So, for all these structures, there are openings specially designed inside the pelvic floor. And for each opening, specialized muscles are there. For example, if the anal orifice is covered by the muscle which controls the fecal discharge whenever required, external anal sphincter. So, if we talk about the vaginal muscles, they are responsible for the sexual activity. If we talk about the urinary sphincter, urethra, and other muscles, then they are responsible for the ubicturation. So there are various specific muscles within the levator muscle. These are the pelvic floor muscles. What are the functions of the pelvic floor muscle? It gives support first. If support is lost, prolapse occurs. Various type of prolapses are there. It gives stabilization. If stabilization is lost, core stability is gone, and gradually it leads to some SI joint pain, some PSD, some any type of joint muscular pain, any derangements, and all those things which are related to various type of low back pains. If sphincteric action, if it is lost, patient can go into the stress incontinence, urge incontinence, or continuous incontinence, mixed incontinence, or also the fecal incontinence. If sexual function is lost, then it can be because of vaginismus. It can cause dyspareunia. It can cause constant regular pain on sitting, constipation. It can cause narrow stream urination and painful micturition at times also. These are not only the four functions, but it is also responsible for the lymphatic function, because it has a slump pump mechanism which also is responsible for the drainage of the lymphatic system. Is also a part. Pelvic floor is also a part of important part of lymphatic system. So, what are the basic? In short, the functions will be like urine control, parenteral cognate support, easy pregnancy and childbirth, intimate health, that is sexual health, fecal control, and back support are the basic functions of it. We can say the over here we can see that what are the major dysfunctions of the pelvic floor muscles. There are basically three type of pelvic floor dysfunctions. One we know very well, muscles if they are very loose, it will be a hypotonus dysfunction. Hypotonus dysfunction, as the picture suggests you, that first one is a told pelvic floor muscle, which is a hammock shaped muscle. If this muscle become weak, it becomes droppy, and the sling increases in size. The U shape is increases, and the organs start hanging down. On the other hand, it can be very much tight also. If it is tight, then that becomes a hypertonus dysfunction. It is only not two type of functions, but there is combination of both the dysfunctions, which is called as incoordination dysfunction. If we take a detailed history of the patient, then we can come to a conclusion, we can come to a diagnosis. Either it is a hypertonus dysfunction, or either it is a hypotonus dysfunction, or it is an incoordination dysfunction. Because if the diagnosis is right, the treatment is right, and patient is going to be benefited. Now let's talk about the tight pelvic floor muscle. Actually, it is a problem. What tight pelvic floor muscles shows? There is the inability of pelvic floor muscle to relax can lead to serious sexual problems like inability to have a sexual intercourse, inability to have a sexual penetration. Painful sexual intercourse can be there. Even if the sexual intercourse is there, it can be painful. Long lasting pain in the private areas can be there. Painful maturations can be there. Constant dysmenorias can be there. Chronic constipations can be there. Other problem will be like low back pain, and urgency will be definitely a problem with the hypertonus dysfunction. So these are the specific clinical features which help us to diagnose the specific conditions. Now let me discuss you, which I talked about earlier, a case history of a 9 years old marriage couple. This is a history. What happened? The patient was a wife of the psychiatrist. He was a doctor, senior psychiatrist, and they consulted Dr. Hey Desai sir at midnight, 11 o'clock, and they were very much fuzzy. They were very much like in a problem, and they told them that there is some patient who is 9 years old, married, and they're going to be divorced very soon. And when the history was taken later on, it was came up that the patient, the female counterpart, that is a wife of the patient, was suffering from vaginismus. Vaginismus is a condition in which the pelvic floor muscles are too tight, very much tight. So what is happening? Patient's posture is very much different. Hypertonus patient posture is very different. She's very very protective in nature, shrink like, and patient will never allow you for a pervaginal examination if such a patient is there, if vaginismus is there. So in that case, patient, there was from 9 years of marriage, from 9 years there was totally no sexual penetration between the couples. And finally, what happens because of that? They were getting divorced. Later on, the patient contacted HITSER, and the treatments were given. After few sittings, the possible penetration was possible. They have a happy married life, and later on they had a couple. And a big thanks were delivered to HITSER for treating the patient. And this history, why I'm sharing this history with you, is that because why the question is why 9 years of suffering was there, why the pair was not happy from the day one, because the problem was hidden. That is why I told you this is a cultural taboo which is not even shared by the couple to anybody else who is very near relative. Even we have back pain, we have any neck pain, we just say this is a pain, and I'm paining, I'm just going to the doctor or whatever, I'm going to have a treatment. But if there is such a problem, so it is a big cultural taboo that the patient is going to share the problem. When problem is not told, it is not sorted out. So, and it is a condition which cannot be cured by any medication, any surgery, because surgery cures by correction of the anatomical part, and here it needs functionality which can be reversed by the exercises only. Let's move on the further slides. Causes of the pelvic floor laxity. Now come on the hypotonus dysfunctions. What happens to a female in pregnancy? The pelvic floor muscles are regularly, when the person gets pregnant at that time, there is regularly a downward force by the fetus. Backs and hips contractions are there. Off and on uterine contractions are there. And at the second stage of labor, when patient persists for a long time, what happens? The baby's head just stuck inside, descends down. At the first it gets engaged, it gets descend down, it gets rotated. Means there is a screwing action inside the pelvic floor muscle. And then after the delivery of head, the shoulder delivers later on and the baby comes out. During this procedure, what happens? The pelvic floor muscles are very much toned, and it is, we can say their abrasions are there, it is damaged. Even if the baby is stuck inside, then a episiotomy scar, episiotomy tear, or we can say a cut has been made to make the space to the baby, and then the babies come out. So at that time, what is happening? If the pelvic floor muscles are strong enough to cope up or with all these problems, then the problems coming in future will be very much reduced to a higher extent. So this is how the damage to the pelvic floor muscle occurs in the pregnancy. Next thing, if you are dealing with a patient with obesity in the pelvic floor, definitely the obesity has a very big role to play, and the duration of treatment will be increased. The result will come later on in the obese patient. Aging is also a problem. Menopause is there. There also weakness and laxity of the muscles will be there. With the hormonal changes, there will be other orthopedic problems associated with it, and it will definitely increase the pelvic floor laxity also. What happens to the pelvic floor during pregnancy? The pictures can clearly show you the things. The first picture on your left side, you can see, is the normal muscle, the tampolin like structure. It is a normal pelvic floor, which you can see. Later on, pelvic floor during pregnancy, it is dropped down like a hammock in which baby is lying. Next, after the delivery, after the parturition, the vaginal muscles remain loose, and it is going on since long eras that the muscles are neglected, and nobody is trying for these muscles to come up again and to get the previous strength again. So that is a big problem for the further problems with the hypotonus conditions. Here you can see when baby is getting parturated out, there is a small screen. You can say here, just a minute. As you can see how the head is getting engaged and the vaginal orifice opens, and like this, the baby getting parturated. Additional problems can be created by vacuum suction delivery and with a forceps delivery also. It further causes the damages. What happens when the pelvic floor muscle become loose? It can be urinary incontinence, it can be a condition of low back pain. Not only these, but sexual dysfunctions can also be associated with the loose pelvic floor muscles. Let us check how. A loose pelvic floor muscle can also cause pelvic organ prolapse. If you're going in a market, we are getting vegetables in a polythene, which you can see in the picture. If these muscles are, if we are getting any vegetables inside the polythene, just suppose if the break is there in beneath the polythene, then every fruit will drop down, every vegetable will drop down. The same thing occurs in the case of prolapse. A picture which you can say, it is a picture screenshot taken inside the operation theater of the patient. This is a case of complete procedentia, that is complete prolapse, grade 4 prolapse, which is absolutely a case of surgery. Complete hysterectomy has to be done for the patient, and this is vaginal hysterectomy should be done for this patient. So this is how it is a alarming sign for the future problems. What happens to the sex life when pelvic floor muscles becomes loose? So this is also a problem which patient is never going to share with even with a counterpart or even with any close friend. So this is a problem which later on leads to anxiety uh, and a lot of psychological problems with the patient. When the pelvic floor muscles become weak or loose, they affect the sexual performance, like the vaginal grip of the penis is weakened, decrease sexual sensation for both the partners, reduce the libido, and decrease the intensity of female orgasm. So when all these things are hampered, then there will be the competency of both the couples will be reduced, and anxiety, stress, depression, chirchirapan, all these comes in the frame. So that is also a psychological problems with the patient, which patient has to feel after this. Now let's talk about the assessment part. Earlier, when I started practicing at that time, there was a modified Oxford's MMT, which we used to use, but there are limitations of it. Modified Oxford MMT is basically has 5 grades from starting from 0, 1, 2, 3, 4, and 5, in which it reflects when you are going inside the when we are going for a digital examination, per vaginal examination, we have to check the pelvic floor muscle strength. We have to give command to the patient to say to contract the pelvic floor, or just hold your pee. When the patient is contracting, either it can be the contraction you feel can be mild, moderate, it can be strong, it can be fair, or it can be no contraction. So these are the various categories by which the Oxford MMT decides. So it is a very vague analysis. One thing which is fair for me can be weak for you. And one thing which is good for me can be fair for you. So the gradings can vary from therapist to therapist. So this was the biggest limitation of the Oxford MMT, which was used to check the strength of pelvic floor muscle. So, seeing the drawbacks, Heitzer has designed a new MMT after an extensive research, which not only the second, yeah, just I just skipped the point that the second limitation of the Oxford MMT is that it is not checking the hypertonus dysfunction. You are not able to check the hypertonus type of dysfunction with it. It is only going to check the hypotonus type of dysfunction. We know there are three types of dysfunctions: hypotonus, and incoordination. So at least these two dysfunctions will be judged by the MMT, which was lacking in the Oxford MMT. So Heitzer designed a new MMT, which is Hates MMT. It is a MMT which has grading from -3 to 3, 3 to -3, starting from 0. That is, you can. I hope you can see my screen clearly. Grade 0 is basically a baseline tone. Let us practice, those who are seeing with me. When this is a basic MMT which we are checking with the patient, and when we are reassessing the patient, at that time this MMT is very fruitful and very useful for us. So how to do it? If we think this is the vaginal orifice of the patient, if we go for a digital per vaginal examination, then when we go with a patient, when we go inside and we say the patient, instruct the patient to squeeze, and the patient is squeezing, and we are feeling contraction from any one side, like this. Can you see? If you're seeing the contraction from any one side, not from everywhere, then this is a grade which we can say is a mild contraction from one side is grade 1. When we feel a complete circumferential grip like this, then that will be grade 2. And if we feel a complete circumference with inward and upward pull to the finger, inward and upward pull of the finger, then that is grade 3, which is the normal muscle strength of ours. This was about the hypotonus, meaning the strength of pelvic floor muscle is judged by grade 1, 2, and 3. Again, if we move on further, if the muscle is not, the patient is not allowing you to go inside, or the patient muscles are tight, in that case, what is happening? For example, this is the vaginal orifice. You are going to touch when the patient is it is very painful. Please don't touch. Patient is not at all allowing you to go for a vaginal examination. In that case, it can be, the pain can be in the perineum, around, there can be a labia majora, minora, and the external genitalia also, but definitely the patient will not allow you to go inside. So what is happening over here? This is called as the grade -1 of the hypertonus dysfunction. Next, when we treat the patient, if patient came with the negative grade 1 -1, when we treat the patient, at that time, if the orifice slightly improves and the tightening slightly improves at that time, if we go inside the digital examination, and the patient is allowing you to go, but it is symptomatic penetration. Oh, don't touch, don't go inside, please don't go. It is painful. Yeah, you can go inside, but it is painful. So this is what is happening. This type of penetration, if we see in the pervaginal examination, that is grade -1. It means discomfort is there. And the third -3 is like a totally asymptomatic penetration, means patient is allowing you to go for a pervaginal examination. So this is the Hates MMT, according to which we go for a first assessment and reassessments, and according to that we design our treatment protocols. Pelvic floor rehabilitation and women health is very deep like a ocean. Every day, each week, every time we see a new condition, we see a lot of things which we can cure. And finally, when we know the basics of pelvic floor muscles, basics of female reproductive system, basics of pathologies associated to that, we will know that when we club all these things all together, it is like an ocean. You know the things, basic things, you will be implementing the treatment accordingly. But first you have to learn the basic ethics which has to be covered under the roof of pelvic floor rehabilitation. This is right now, this is a time of a future of specialized physiotherapy. So that's why we are working over here, and all of us will get success by working in specialized branches rather than being jack of all trades. We should start with our friends, family, and yourself also. If you have any problem like that, it will give us confidence, it will give us results. It's not a difficult field and a rewarding field once you know the things how to do it. What we will learn, we are following these things under the roof of POWIP. We are organizing workshops all over the India. I am a licensed clinical instructor in Rajasthan. I am conducting a lot of workshops over here, time to time. So this was my first workshop for fertility reproductive rehab, 2022 in Jaipur, 2022 in Udaipur, and 2023, the recent workshop which I'm going to take for transvaginal and transrectal workshop will be in Jodhpur in coming days, 23rd and 24th of September this month. We have two levels for the workshops for the patients to for the therapists to understand. Level 1 is a non-invasive pelvic floor rehab practitioner. It is absolutely a non-invasive course in which we can treat the patient without going through the transvaginal route, because many patients don't allow you to do that. So it can be done for that. Next, functional anatomy, physiology, pelvic organ, bladder, uterus, vagina, rectum, anal canal, etc. are taught under this category. Anatomy, functions of pelvic floor muscles, layers of pelvic floor muscles, all of the muscles, different layers with that, attachment of the muscles individually as well as the group. It is taught functions of other muscles individually as well as the group, function of different layer of the pelvic floor muscles, nerve supply to the perineal area, how to check the nerve, how to cure it, dysfunction of pelvic floor muscles, various type of dysfunctions we have talked about recently, causes of pelvic floor dysfunctions which we talked recently, assessment of pelvic floor dysfunctions, basics of history taking, observation of the perineum, subjective observation, subjective observation, objective observation techniques and assessment techniques are taught. And the management of pelvic floor dysfunctions is completely the theoretical. All the aspects are covered in the level 1, which is an online webinar for 7 days regularly, and the contact hours are 2 hours 30 minutes to 3 hours, and it is a 7 days online webinar. And so level 2 is a complete invasive pelvic floor rehab practitioner, because when 1 the non-invasive pelvic floor therapy doesn't work at times, then level 2 has to be opted and internal examination become important. Here in level 2 we teach counseling of the patient, how to counsel the patient, how to take the history, what are the basic requirements for the patient's room therapist preparation, how to do the perineal observation, how to go for perineal palpation, how to go for transrectal and transvaginal palpations, how to go for transvaginal and transrectal pelvic floor assessments, how to use Hates MMT, SURF scale, ring clock assessment scale, and reflexive result scale. Go for how to release the soft tissue structures inside the perineum, that is in the pelvic floor muscles. Myofascial releases are taught, trigger point releases are taught, sweet spot release, Thiel's techniques, Weiss Anderson's techniques, active relaxation of pelvic floor muscles. How to go with cryotherapy, it is a different part. How to give in the on the perineum is a very different thing, and how to go for transvaginally is also a different thing. Use of vaginal dilators, how to use the VEs, how to use the market available vaginal dilators, it is also a big task to be learned. Next, PNF of pelvic floor muscles is taught. Ring clock assessments for various weak muscles around the perineum is used. Neuromuscular re-education for weak muscles of pelvic floor muscle by using technologies we use, and we train the candidates for the same using EMG, periometer, ultrasound, IFT, how to use with the for the perineal pelvic floor rehabilitation. Hypertonus and coordinated dysfunction, vessel dysfunction case studies has been discussed, and that is a very big eye opener in our workshop. Pelvic floor rehab in pregnancy, how to recruit it, how to go with pelvic floor rehabilitation and back pain especially. Lots of hand-on sessions are there. It is completely hands-on workshop level 2, and level 1 is for the knowledge and for of all those things, and definitely those who implement get results, but many times invasive techniques are required. There we go for complete hands-on session for 2 days, and strategy to enhance how to go with the practice after completing this workshop is taught in it also. And next, complete there is a, after completing both these workshops, the thought process will be changed. There's a complete transformation of the therapist from thinking just the therapist will start thinking beyond the box, which is a mission of HITSA. And the various step of incontinences are taught, vaginal laxity, prolapse, post-surgical cases, how to assess, how to treat them, episiotomy scar, how to treat the episiotomy scars, postnatal problems, painful scar, coccydyna, vulvodyna, prenatal, postnatal pelvic floor dysfunctions are judged, assessed, and treated. Post-surgical pelvic floor dysfunctions are important to be treated because there is no other treatment of those. Oncological conditions also affect pelvic floor muscles. That is also taught. Pudendal nerve dysfunctions, back pain, and pelvic floor dysfunction. Each and every point and topic I discussed right now is itself as an exclusive case when you will start working in the same field. Coming to the convention, at last, I will just discuss with the HCERS provider protection guidelines, which is the basic of pelvic floor rehabilitation. Privacy maintenance of a patient is very different. We should come out of the comfort zone of practice if we want to work in pelvic floor rehabilitation. There are a lot of uh, fields. There are a lot of. It is like ocean. It is an open screen for you to put things over. Female to female, privacy is very important first. Next, female to female and male to male practice is definitely supported in vow because legally it is much acceptable. There should be no CCTV cameras when we are treating a pelvic floor patient, and there should be 100% modesty because patient believes in you and tells you the personal problems. It should not at all be shared by any person outside the examination room. That is the 100% modesty with the patient. These all basic things will make us a big and great pelvic floor rehab practitioner. Basic problems which we come across in females is vaginal laxity, urinary incontinence, pelvic organ prolapse, female sexual dysfunctions, and pelvic pain. In case of male patients, there are erectile dysfunctions, premature ejaculation, and pelvic pain. Let me tell you, males are equally in a big problem, more than the female, because I am seeing the patients from last time, so I am getting the queries about it, so I know that. Pediatric also rehabilitation physiotherapy is required for bedwetting and encophresis. Encophresis is a condition with fecal leakage is there, and bedwetting is there. I have seen recently a case. Child, she was 15 years old, and still the menstrual cycle was started, and still she was bedwetting. So it is a very big problem with many pediatric patients and adult also, and adolescent patients also. Anorectal malformation is also a condition which is cured by physiotherapy. Uh, Anorectal malformation post-surgical cases are mostly seen. So this is our team, which we are all over the India. We are taking various seminars and to making the HCERS dream true. Why is the number one pelvic floor education? Because under the guidance of legendary leadership, Dr. Hidesai sir, and this is basically we have got certification of recognition from Government of India regarding our tools, regarding search intellectual properties. There are many businesses, mostly non-medical, which might have received startup. However, big difference. Wow, FT is number one for the pelvic floor education, first and best international institute, specially privileged to receive certificate of recognition from Central Government of India with legitimate DIPP number, which is that's why we call it authentic to provide specialized training to perform transvaginal and transrectal pelvic floor rehab, to place skilled pelvic floor rehab specialists to gynecology, urology, and urogynecology and urologist, to develop the franchisees also in domestic as well as international market to carry on same activity and to create win-win situation as it will benefit millions of patients to get specialized care, to benefit doctors and hospitals by creating more revenue and multiple jobs, to offer innovative business model to offer unique services to bridge the gap between the patient and specialist with a simple but highly efficient business plans and improve patients health, well-being, and doctors business and services. So this is all over the world. We are also taking webinar seminars outside India with WOW. There's a book which I have already discussed about, Hates Manual of Pelvic Floor Research and Rehabilitation, is available on Amazon, and it is a single source of knowledge which is written by an Indian researcher. It is proud moment for all of us. We should go through it. It will definitely resolve a lot of your problems in if you are going to work in pelvic floor rehab. You should go through it. Academic contributions are various type of scales: FMT, ring clock assessment, self assessment scale, provider protection guidelines, reflective result scale, female sexual dysfunction, and male sexual dysfunction. These scales which we have already discussed. There are various dignitaries who have supported and endorsed the concepts of HATSER nationally and internationally, like Dr. Vineet Mishra, who is the founder president of South Asian Federation of Urogynecology, ex-president and ex-vice president, Federation of Obstetric and Gynecology Society of India, Dr. Alpesh Gandhi and Dr. Haresh Doshi, national president of Indian Medical Association, Women Doctors Wing, Indian Medical ex-president, Urogynecological Society, Dr. Mahesh Desai, and registered clinical exercise physiologist, American College of Sports Medicine, Chad Grover, and many more national and international dignitaries are endorsing the work of HITSA. Other brands are also available, and this is how the authenticity of State University has given. Gujarat University has proudly introduced HITSA's intellectual property like HATE MMT in syllabus of Master of Physiotherapy war against silent sufferings. Dr. Hibisisa, thank you, Wow Hitser, and thank you, UEM team, for presenting me this webinar. Thank you.
Thank you, ma'am. I hope this session was knowledgeable for all the students who have joined and taken the session. If anyone has any doubt or any question regarding the session, you can please comment here and we can get back to you.
Are there any questions from the other end?
No, ma'am, I guess there are no more questions here. Thank you for the session, ma'am. Thank you.